Maybe I can request group one, Natalie and Goldie. If you have selected a rapporteur, please go ahead. Please try to share within the next 3 minutes if possible.
Thank you, Nina. Courtney, do you have the slide for me? And we kind of not very democratically decided to do it ourselves, the report. We had a very interesting discussion. We had to stimulate a bit, but Natalie presented very shortly on the importance of the participation and partnership of parents in the KMC programs, also the challenges during KMC. So in general, the having not enough space to practice KMC was one of the themes that came a couple of times. The fact that health workers are overwhelmed with the workload, and the focus becomes checking off their boxes versus spending time orienting the parents on KMC. The support from other family members is limited due to the COVID-19. There is enormous amount of anxiety from parents and healthcare workers for early skin to skin. They don't have enough tests to know the status of the mothers. They don't have enough PPE. There is not enough room to separate COVID-19 suspects and non-COVID, which is something that is done in Colombia, which results in early discharge of the babies, sometimes with not enough skills. The parents don't have enough skills. Systematic practices can become disrupted, and lack of resources. So some of the solutions that were proposed, because not everything is bad, is for example, where there's no space, not to pretend that the mothers stay for 24 hours, but to do intermittent KMC, maybe 12, maybe less. The fact, Natalie mentioned an experience that she had yesterday, a couple of hospitals where one learned from the other that even though the one that was learning has more staff, the one with less staff was still able to do KMC. In Portugal, they test all mothers, and if they're negative, they stay in the maternal unit and don't go home. In Kenya, there is a very interesting, in one of the hospitals in Kenya with our colleague Boga, where she carries out emotional training for the staff in order to create that competence and deal with the parents. Do we have anything else? I think that was in a nutshell. And we stimulated the participants. We had 25 people in a room to continue to send us questions, and we will send to our experts and respond via email or in our community of practice. So thank you very much. Thank you for the participants. To the participants, thank you to Natalie. We had two other experts, KMC experts in the group, and Marie Berg and Suki de Leon Mendoza, from South Africa and the Philippines, respectively. Thank you very much.
Thank you, Goldie and Natalie. Let's move on to the next group. And I'm looking at the time too. And so if you have questions for the presenters, please start chatting it in the chat box and we will capture all of that. Thank you. Next.
Thanks, everyone. Can you see my screen?
Yes.
Okay, so in group 2, where we were focused on infection prevention, we noted some key challenges. The obvious one is availability and convenient placement of infrastructure and commodities. So while many health facilities have infrastructure, it often doesn't extend into the wards and the points of care. And when it's there, it may be on the other side of a large room. And so trying to make more of that available in convenient locations for providers and caregivers would be essential. We talked a lot about behavior change and challenges with motivation, with time and patient load, with staff focused on protecting themselves instead of thinking about the infection risk for the patients, or trying to ration supplies because they're in limited availability. And we also talked about the infection risks with basic procedures like using a thermometer with multiple patients without disinfecting it. And then in terms of challenge and solutions, we only just started this conversation when the time ran out, but we talked about, obviously infrastructure investments are needed to improve and extend infrastructure. And we thought there were opportunities related to the COVID response because so much global attention and investment is being put into this. And also the ability to leverage available and emerging technologies in this space related to infrastructure and products and services, and then orienting staff to infection prevention and control expectations, and then conducting behavioral audits of staff routinely and giving them feedback so that they can make improvements within their wards, and utilizing IPC managers or committees to do those audits and to evaluate like infection prevention readiness in facilities, and also to look at death audits to see what the infection risks are and where the breakdown in the infection prevention and control program was so that improvements can be made. That's a summary of Group 2.
Okay. Last but not the least, the last group, please. Queen and Steve, your team.
Would you put up the slide, please? And
sure.
Shabina has them. Okay, Shabina, thank you. Shabina, you're muted.
Hello, can you hear me?
Yes.
All right, hi. Hello, everyone. And so our group was Group 3, and these were the challenges that we're facing in the community in the COVID era with care of the small and sick babies. Basically, this was around family-centered infrastructure and commodities, and our group had Queen, Steve, and Mirtu Pandey, and it was a very good, healthy discussion about how can we continue the care of small newborns in the community and what are our challenges. And I think most of us highlighted the aspect of having a lot of premature small newborns in the sub-Saharan Africa and Asia, and sharing of cots and warmers. And over the recent years, the push towards kangaroo mother care, although knowingly that there's lack of incubators, there's lack of skilled people to look after those incubators. So the push is towards kangaroo mother care, and there is a need towards thinking of taking this kangaroo mother care from the units towards the family in a family-centered approach, and considering more space for the mom and family members maybe, and rather than just moving towards a unit where there is only space for the newborn. So if you are to bring the family into the care of the small babies, then the push has to be towards thinking what is more contextual, and where we can involve the family, and it could be started in stable babies from the hospital, from the unit, so that this care can move forward towards the community. There's a lot of thought about, and there are concerns in Asia and sub-Saharan Africa where the babies and the mothers are not rooming in, and especially with the COVID, there is also this fear that the newborn baby may actually end up developing COVID infection, and therefore, keeping the babies close to mom, especially more so now with this fear, has been highlighted, and this needs to be thought of very thoroughly thought of, how to ensure that mothers and babies stay together. There's also this issue about the health of the mom in terms of nutrition, that how can we ensure that moms receive adequate nutrition, and their families also, so that they are in a position that they can provide adequate care to the newborn babies. And yes, we cannot, I think we all feel that hospitals cannot do everything, and it's time that we move from hospitals to home, and there's bridging that is needed from hospital to home, and where family care should come in. There was thing, how can we educate parents? So one of the thought process was that maybe there should be group counseling of moms when they're in the hospitals or during antenatal cares, and the moms are more receptive to midwives and nurses rather than the physicians. And there's a lot of midwives and nurses and community midwives which are available and who can actually educate parents regarding what sort of care can be given to these babies at home, stepping out of the hospitals into the community. The other question was that we discussed about the NICU. Many African settings have small NICUs, and I spoke earlier that there is these NICUs are crowded, and there's box sharing, there's cot sharing, there's incubator sharing, and it is only now that we know that neonatology or newborn care is now probably in the fetal stage, and neonatal units are being formed. So I think while they're being formed, at the same time that the group thought, and there was a discussion around how we can ensure that it is thought through correctly, so that there is enough space, enough infrastructure to provide kangaroo mother care, and not only kangaroo mother care, but also father care and other nutrition that the baby needs, breastfeeding. That is thought through when we're considering construing these neonatal units, and there has to be space for breastfeeding, there has to be space for counseling, and so that when the parents go home, they can continue the care beyond the hospital. Then there were some comments regarding immediate kangaroo mother. That's a challenge. Okay, sir, that's a challenge that we have seen in Asian countries, and I believe more so in Asian countries than in African countries, of immediate KMC, that is putting the baby immediately onto the mother's chest right after delivery. And this has been a challenge for us, and I think challenge throughout Asia, because most of the time the baby is separated from the mother right after, and then later on, once the mother is back into the ward or she's out of the labor room, then the baby is handed over to the mom. So I think there was, can we have more competent nurses? Can we increase the number of nurses so that we ensure that these mothers, they're actually taught to practice immediate KMC, and they're encouraged. Because there has to be somebody, and then there was this challenge of C-sections, so postpartum and C-section. C-section mostly the moms need some form of guidance, and the control of pain. And C-sections, they're done differently in the developed countries versus the developing countries. So there's this element that they feel that after C-section they're unable to keep the baby onto the chest. And so these are the challenges where we need more education and more information to the mothers, so that they can practice early KMC. And of course, there was this attitude that so when the attitude, and this is something very nice, that mom's smile and satisfaction is a powerful advocacy tool. So moms, successful KMC mothers, KMC champions, can be the ones who can actually advocate for home care, for kangaroo mother care, for father care. They would be the excellent advocate in this scenario. So the other question that was that, if the moms are being trained about KMC and benefits.
Shabina, sorry to interrupt. Could you just end in another 1 minute, please? Sorry.
Yeah. Sorry.
Thank you.
So this is the last slide, and thank you for bearing with me. So basically, the discussion was that how can we improve and create packages so that both, the care does not finish in the hospital, but it is carried down to the community, and how we can ensure that there are adequate follow-ups and these babies whose mothers are practicing KMC, they can benefit. They can benefit from skin-to-skin contact. And how can we make this cost-effective, community-based intervention more successful and powerful? Thank you so much, and I'd like to thank my group, the participants, and we had Steve, we had Queen, I think there was a lot of good conversation around it, and I think there's a lot that can be said more, but I'll stop here. And thank you for giving us an opportunity, Nina, and everyone. And there are a lot of experts here, and I'll have to thank all of them and my colleagues as well. Thank you. Over to you.
Oh,
Nina.
thank you. Thank you so much. This is overwhelming, the amount of information that's come from the groups and also in the chat boxes. I tried keeping up, but I couldn't in the end. So I think we are going to be able to capture all of that. And ETN, Lady, and team who are working behind the scene will be sharing the access to recordings, also supplemental materials. But we would, as ETN and I shared in the chat box, please continue the conversations. And if I may request you on behalf of the COP, we are here to serve you. If you want a particular topic discussed next time around, please feel free to share it, please. And if any country wants to talk about anything, just feel that this is your platform and we'll be helping you organize it. And notes from the discussions will be pulled together and we'll put it into the website, the COP, and also the Healthy Newborn Network. So if anyone is not a member of either, please go ahead and become members. And until next time, stay safe, stay healthy, and stay happy. Bye-bye.